Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaz. 22,000 PYQs we are going to master in the next 200 hours. As a part of this series, we finished 450 PYQs from the FMGE exam where anatomy was over. Now we are in anesthesia. So every day we will try to finish at least 100 to 150 PYQs in our evening session. Can the online students punch? Is the voice loud and clear for all of you, doctor? Can you please punch? Now, what is the most important determinant of the resistance for the flow of the air in an endotracheal tube? Always it is the radius, right? So what is the relation between the radius and the resistance, doctor? You should remember radius to the power of 4 is proportional to 1 by resistance. So the change in the diameter will keep changing inversely changing the resistance is what you need to remember, the fundamental principle of physics that we learned in our pre-MBBS days. So doctor, what is the inhalational agent of choice in children? So you should remember it is the sevoflurane. You can remember sevoflurane is for tissue. Sevoflurane is for tissue. Tissue means small kidney. So sevoflurane is the inhalational agent of choice is what you have to remember. Now, which inhalational agent uses a special vaporizer? So it is the desflurane. Desflurane which uses the special vaporizer. Now, whenever you are doing resuscitation, CPR, what will you do? You do the CPR and then check whether the condition can be defibrillated or not, right? So, if it is good to go for defibrillation, then you will defibrillate, right? You deliver around 360 joules of shock. Then once more, if the patient is not in a defibrillatory stage, you need to continue the CPR. So the algorithm of CPR, you need to know for the tomorrow's NEETPG exam. Very good to see 7 online classmates. Now, the colors of the cylinders is the favorite question of the examiner doctor. The colors of the cylinders. So what is the color of the nitrous oxide? Nitrous oxide is blue in color. Nitrous oxide is blue in color. Please don't forget. So this is how typically the nitrous oxide cylinders looks like that. Nitrous oxide is blue in color is what you need to remember. Now what is the level of the spinal anesthesia in adults? At what level you can give? So in adults, where does it end, doctor? So you should know where does the spinal cord end in case of children and also in adults. So it is the L1 is the level at which in adults the spinal cord will be ending. And in the case of the children, it is the L3 at which the spinal cord is ending. So L3 in case of the children and L1 in the case of the adults. That's the reason in adults, whenever you are doing the lumbar puncture or spinal anesthesia, it needs to be given at the level below the L1. That means between L3 to L4 is the level at which anesthesia, spinal anesthesia is being administered in the case of the adults. Here's what you have to remember. Now, doctor. You can see very clearly at the level of the L3 to L4 is the level at which you will give in case of the adult. In the case of the children, since the spinal cord ends at the level of the L3, you give it at the level L4 to L5 level in case of the infant. And what is the position in which you give the anesthesia doctor? Sitting lateral prone. Whenever it is a anorectal procedure, then you will be doing it in the prone position. And whenever there is any hyperbaric solution administered, or if the patient is in a jackknife position, so these are the various positions in which you give the anesthesia. So remember, adults it is L3, L4 junction, and in the case of the infants it is between L4 and L5, below the level of L3, where the infant spinal cord will end, is what you have to remember. Now, what is the duration of the spinal anesthesia? How long the spinal anesthesia depends on what? It is directly related to the dose of anesthetic that you have given. The more the dose, the longer the duration for which the spinal anesthesia will continue is what you need to remember. Whenever we talk halothane causes hepatitis. Halothane causes hepatitis, especially on repeated usage. Halothane is known to lead to hepatitis. Propofol is also called milk of amnesia, just like milk of magnesia. Why? Because propofol is a white colored fluid which is typically used in the daycare surgery. Like for example, you are doing an endometrial biopsy. Right? In the daycare surgeries where you need a short duration, propofol is the one which is preferred. So you should remember our popular milk of amnesia is the name given to the propofol. Milk of amnesia. This is how, like a white thick fluid is the propofol. Now in the CPR, whenever you are doing CPR, how many chest compressions per minute is recommended in adults? Fundamental question. It is 100 to 120, a number you can't do a mistake in the tomorrow's exam. Definitely going to be asked, be very sure, doctor. So whenever you are doing CPR, 100 to 120 compressions per minute is at which you will be doing. And also you should remember that how many rescue breaths? For every 30 chest compression, 2 rescue breaths. How many? For every 30 chest compressions, it is 2 rescue breaths. And how deep you need to do, you can't do simply like a Thai massage slowly, right? 2 to 2.4 inches you need to push it down. You need to virtually sit and break a couple of ribs. 2 to 2.5 inches, 5 to 6 centimeters is the depth to which the CPR need to be done. Is a favorite HYF, highly fact, in the tomorrow's NEETPG exam. So this once more, 100 to 120 compressions per minute, as what you can see here, and 2 inches is the depth with which you need to apply the thrust is what you have to remember. Now, what is the structure that you will be piercing while doing the epidural block? So it is a ligamental phlegm. Earlier class also I told you what are the different layers through which the needle while doing epidural injection typically pass through. Right? So this is how you can see there is a supraspinatus ligament. Then you have a intraspinatus ligament all over. Right? Then you have the ligamentum flavum. This is the ligamentum flavum. This is the duna mater. This part is duna mater. and you are having the subarachnoid space which is containing the fluid, CSF. So you should know what are the various layers through which the epidural puncturing, typically the needle will pass. What is the anesthetic known to lead to methemoglobinemia? So you should know it is the benzocaine. Benzocaine causes methemoglobinemia. So very good to see 5 online classmates. Can you please punch? Is the voice loud and clear for all of you, doctor? Yeah? Now, this is what you recognize, methemoglobinemia. So what is the most likely culprit, doctor? Benzocaine. Benzocaine is the anesthetic known to lead to the development of methemoglobinemia is what you should remember. Now what is the correct sequence for you to do the resuscitation? CPR, then do defibrillation is a part of the advanced life support. So first is assessment, then CPR, then defibrillation, advanced cardiac life support. So first what you do? Compressions. Just compressions. Then this is the airway. Airway, you need to get the airway clear. Then the breathing. So this is the order in which CAB, CAB is what you should remember. Now, what is the opioid, which is often used as a management of the pain at the time of anesthesia? Remifentanil. Remifentanil is the shortest acting opioid. So these are all like small, tiny quiz questions kind of thing which you need to master, doctor. Nice to see Chaitanya and many more. So can you please punch his voice, letters, everything is clear for all of you, doctor. Now, typically in epidural, right? So intravenous, intrathecal. So there are the various forms by which the anesthesia routes are basically. So how do local anesthetic function? You give lidocaine, etc. So local anesthetics mainly affect the A delta fibers. A delta fibers are the ones which carry the pain sensation, is what you have to remember. Now, Bayer's block. So what is Bayer's block? Bayer's block is a technique called IVRA, intravenous regional anesthesia. So you'll be applying a tourniquet and giving the Bayer's block, and it provides anesthesia for 1 hour. For what duration of? 1 hour. So this is how typically you are applying a tourniquet and then giving a intravenous anesthesia in order to extend the duration of the anesthesia, which is typically called the Bayer's block. Now, cracking of the cylinder valve is basically to blow away, what the purpose, any foreign matter from the outlet. From the outlet, you need to remove, just like we use the cylinders in the home, right? So like that, cracking of the cylinder. Now, what is the way you absorb the carbon dioxide in the breathing circuits? Breathing circuits. We use soda lime at the time of anesthesia to absorb the carbon dioxide in the breathing circuit. So how does it look like? A lot of times this is a very good image-based question. So you should know the soda lime, how the soda lime in a rebreathing circuit, and what is the purpose of it, you need to know, doctor. Now, the cuff of an endotracheal tube, what is the main purpose? In the endotracheal tube, the cuff is mainly to prevent the regurgitation of the gastric contents into the respiratory tract. That's the purpose of the cuff. So you can know that there is a cuff. So what will you do? You will be typically passing the air and leading to the blowing of the cuff. If you blow it with more pressure, it can lead to the development of endotracheal damage. So optimally you need to blow it, and it prevents the secretions in the GIT entering into the respiratory tract is what you have to remember. Now, how do you monitor whether endotracheal tube is in place or not? If the endotracheal tube is inside, then the carbon dioxide exhaled will be detected. And how do you detect that? We use the capnography. In the last class, we discussed about the capnography, different capnographic patterns. So, which is the anesthetic agent which does not undergo any enzymatic degradation? Rather, it is a non-enzymatic degradation called Hoffman's degradation. It is the atrecurium which undergoes Hoffman's degradation. So whenever the patient is having a very high serum bilirubin and also high serum creatinine, what is the agent which is preferred? It is the atrecurium which is preferred whenever the patient is having a renal failure, hepatic failure, because atrecurium is metabolized by the non-enzymatic degradation is what you need to remember. Now, why certain agents like succinylcholine lead to malignant hyperthermia? Basically, you need to remember it is the ryanodine receptor. Ryanodine receptor may genetic defect will make certain population vulnerable to the malignant hyperthermia when you are using the mother relaxant like succinylcholine. So you should know the flow. Whenever there is any mutation in the ryanodine receptor, there is an altered calcium release channel protein, and there is this mutated channel will open very easily, and it stays open longer, and that will flood a lot of calcium into the cytosol, and the high intracellular levels of the calcium, it stimulates a sustained muscle contraction which leads to the development of the rigidity in the malignant hyperthermia. Also, the high calcium also stimulates the breakdown of the glycogen, leading to glycolysis, aerobic metabolism, leading to excessive production of the heat. That's the reason it is called malignant hyperthermia, is what you need to understand. So, which is an example of a fast non-depolarizing muscle relaxant. So you should know the classification of the muscle relaxants into depolarizing, non-depolarizing. So all the curare derivatives are all curare derivatives. Atrecurium, rocuronium, picuronium. Curare derivatives are all non-depolarizing, and rocuronium is the fastest out of all the non-depolarizing muscle relaxants, is a point of interest. For the induction and a smooth induction and rapid recovery, there are two things. Smooth induction, rapid recovery, for which thiopentone is the king among the inducing agents. The two reasons are rapid induction and smooth recovery. Very, very important to remember. Now, whenever there is any foreign body in the trachea, to relieve it, what will you do, doctor? Heimlich's maneuver. In Heimlich's maneuver, give 5 blows. So what do? You give 5 blows. Give 5 abdominal thrusts. So these are the two things which are done in the Heimlich's maneuver in order to relieve the foreign body. So you should know the various instruments which are used for ventilation, right? Like non-invasive ventilation, BiPAP machines, CPAP, ventilator, everything you need to be very sure about. So this is a laryngeal mask airway. It is also called LMA. So LMA is used for maintenance of the respiratory tract without flooding of the GIT juices into the respiratory tract. So a lot of times examiner will give you an image of a LMA and ask you to identify. So this is the typical LMA. You can see it is also called supralaryngeal airway device. Inside the larynx, passing through the larynx is what your regular endotracheal tube will do. What is larynx? Larynx is the place where you have your vocal cords. Passing down that is what ET tube will do, endotracheal tube. But above the level of the vocal cords, if some barrier you are able to place and prevent the aspiration, that is what supralaryngeal airways basically will do, is what you need to understand. So now, how do you know that there is a obstruction of the tracheal tube? Any increased peak pressure or increased plateau pressure at the time of the inspiration, at the time of the mechanical ventilation, is a very important indicator that, oh, the tracheal tube got obstructed. So a lot of you are going in future to become top intensive care specialists managing the ventilator day in and day out. You'll be looking and peeping through so many monitors which give you an indication whether the endotracheal tube is obstructed. So what is the parameter you look for the endotracheal obstruction, doctor? It is the increase in the peak and plateau pressures is an indication. Now, what is the color of the oxygen cylinder? So colors of the cylinders is a favorite area for the examiner. There is a black body which has a white shoulder, like our uniform during the Independence Day. Okay? So now, you need to know oxygen, right? Oxygen. It is the black top. Right? So, you can otherwise remember, obviously the most important gas. Nitrous oxide, blue, both are blue, top and bottom are blue. Here, top is black, bottom is white in oxygen. In air, top is black, bottom is black and white. Then carbon dioxide, top is grey, bottom is grey. Anthrax, top is blue, bottom is blue and white. Heliox, typically brown is the top and brown and white is the bottom. So what is on the top, what is on the bottom of the color of the cylinder, you need to be 100% sure. In the tomorrow's NEETPG exam, you should identify based upon the cylinder image. Which gas cylinder it is a simple question you need to be ready with. Now, pin index. So what is the pin index for oxygen? Why do we need pin index? So basically you require pin index because there can be a mismatch. So you have the anesthetic equipment and you have the anesthetic gas cylinder. So if the gas cylinder, the gas that you need to give, if you confuse between oxygen, halogen, nitrous oxide, etc., there can be a problem for the patient. So how do you overcome that? So fundamentally there is a lock and key model. The pin index should match, then only this particular cylinder will fit. Alright? So that is what we call 2,5. It is like that in the suitcase you will have the numbers, right? Combination of numbers to open the suitcase. 2 and 5 is what you have to understand. So you need to remember by heart all the pin indices. Oxygen 2,5, nitrous oxide 3,5. So this is how 3,5, this is 2,5 looks like. Air is 1,5, carbon dioxide 1,6, Antonox 7. Antonox is 7. This is called 7 position. So this is what we need to be very, very clear about. Once more, repeatedly asked question, pin index of nitrous oxide 3,5. So this is how you have position 1, 2, 3, 4, 5, 6. This is left, this is right. This is how, this is the anesthetic machine and this is the gas cylinder, and typically you are having the various places where like a suitcase it will fit, and most important, you want to pack the suitcase to go to All India Institute of Medical Sciences as a topper. You need to remember these lucky numbers for pin indices is what you have to remember. Now, what is the main purpose of this pin index safety mechanism? It is mainly to prevent the wrong attachment of the cylinder to the machine. Wrong attachment of the cylinder. ASA, American Society for Anesthesiologists, they have created a scoring system to know at the time of pre-anesthetic checkup, to know the well-being of a patient and the status of the patient, the risk of anesthetizing a patient, basically. So, what are the various statuses under the ASA system? ASA1, normal healthy. ASA2 is mild systemic. ASA3 is severe systemic disease that is not a constant threat of life. ASA4 is severe systemic disease that is the constant threat to the life. And ASA5 is a moribund patient not expected to survive if you happen to take him to the operation theatre and try to do the anesthesia. So simple classification. So how do local anesthetics function? Local anesthetics basically act by blocking the sodium channels. That's the mechanism. It is not calcium, it is not magnesium, it is sodium channels. Right now? Now, if you look, this is the pain stimulus, a sensory nerve is carrying to the spinal cord. So here you can see the sodium, and there is a local anesthetic binding site, right? So there is an inactivation gate which is typically cause the sodium to get closed when the local anesthetic happen to bind. So the fundamental mechanism by which the local anesthetics happen to block cause a pain relief is by blocking the sodium channels. So the local anesthetics block the sodium channel. Now, what is the anesthetic agent that can lead to that has a vasoconstrictor function? That's the reason it is contraindicated in the ring block. So you should remember, it is the cocaine. Cocaine is the one which by itself has got a vasoconstrictor action. So most of the local anesthetics needed to be added with adrenaline in order to cause vasoconstriction. But cocaine doesn't need it. Another point, cocaine cannot be used in a ring block because it is the end vessels, right? So they can go into ischemic necrosis. That's the reason it can't be used in the ring block. Now, Dibucaine. So Dibucaine is not a ester group of local anesthetic. That means examiner want you to remember what are the Amide group, what are the ester group of anesthetics? So please punch doctor, is the voice loud and clear for all of you? Then chloroprocaine is a ester group of local anesthetic. So now you need to mark these points. How to remember amide type and ester type? Very easy. Bupivacaine, what is there in the spelling? Bupivacaine. Two I's are there. Ropivacaine, two I's. Dibucaine, two I's. Lidocaine, Lidocaine, so two I's. Mepivacaine, Mepivacine, two I's. So prilocaine, mepivacaine, lidocaine, dibucaine, ropivacaine, bupivacaine, they're all the examples of amide. In that, bupivacaine, ropivacaine, dibucaine are called long-acting, whereas lidocaine, mepivacaine, and prilocaine, they're all short-acting. So please don't forget, intermediate acting. Coming to ester type, ester only has one I, letter I in its spelling. Tetracaine, only one I, but it's a long acting. Intermediate acting is cocaine, only one I, but intermediate acting. Short acting are procaine, chloroprocaine, benzocaine, only one I in their spelling. They're all ester. Two I's are amides. How do you remember once more? Already I is there in amide. That means it has a lot of I's. That means two I's, not one I. In the spelling is amide. Is all that you need to understand. So, procaine. What do you have in procaine? Only one I. Only one I is there. What do you have? Only one I in procaine. That's the reason it is a ester type of a local anesthetic. Ether. Ether is very easy to administer and one of the most popular thing before 1970s. Even in village also, without any special equipment also it can be given. So ether has got a very slow induction as an anesthetic agent. Then bupivacaine. Why do you need to remember? Bupivacaine is cardiotoxic local anesthetic. Heart. B for bupivacaine, C for cardiotoxicity. You can't forget. Then alfentanil among the opioids. One of the important side effects is chest wall rigidity. Then we see the muscle rigidity whenever we give fentanyl. What is it because of? Because fentanyl lead to the activation of the mu receptor. So you should know the various opioid receptors. Which side effect of the opioid receptor is because of the which receptor is a favorite question. So you can see we have analgesia, right? And what is the most important thing? It is the mu receptor. But this mu receptor can lead to respiratory depression, constipation, desensitization, and all that. Whereas it is the adenyl cyclase receptor, where ATP is converted into cyclic AMPs because of the adenylase cyclase activity, we have the analgesia. Whereas the mu receptor activity is responsible for respiratory depression, constipation, desensitization, tightness of the chest wall, etc., whenever you are using the opioids. Succinylcholine is known to be notorious because of its malignant hyperthermia. Malignant hyperthermia is due to ryanodine receptors. The shortest acting non-depolarizing muscle relaxant is Mivacurium. So malignant hyperthermia is most commonly because of succinylcholine among the muscle relaxants. Then doxycurium, why do you remember it? Longest acting neuromuscular blocking agent, agar kuch hai to, that is doxycurium. You can remember dexamethasone is very powerful. Anything with D is very powerful. So doxycurium is longest acting. So whenever you are giving general anesthesia, lot of secretions are there, you want to control it, you want something which is anticholinergic. Because cholinomimesis leads to increased secretions, anticholinergic will lead to drying of the mouth. So glycopyrrolate is the one which is used to control the secretions in the general anesthesia. So many times the question repeated, pediatric patients may sevoflurane is the agent of choice. Propofol is used in the day-case surgery, right? Now, if you are using propofol, it is all good, but there is one thing that you need to know, that propofol has a tendency to cause vomiting. So propofol is an agent which has a very good emetogenic potential. In spite of that, we give it for day-case surgery. Then post-anesthetic nausea, vomiting. Favorite question once more asked in the FMGE exam is propofol is the agent that you need to understand. Then sevoflurane is the fastest acting inhalational anesthetic agent. So once more, what is the list of inhalational intravenous anesthetics? We need to be very, very clear. So whenever there is any renal failure, hepatic failure, we use endotracheal because endotracheal don't need enzymes for degradation. It undergoes a non-enzymatic Hoffman's degradation. Dissociative anesthesia. What is the agent of ketamine? Everything, anything about the ketamine you need to be quite sure about. Where is ketamine contraindicated? Whenever there is any raised intracranial pressure, ketamine is very notorious. Everything is raised. Heart rate is raised, BP is raised, intraocular pressure is raised, everything is raised. That's the reason it is contraindicated whenever there is a raised intracranial pressure. Thiopentone contraindications, typically contraindicated in porphyria. It is contraindicated in porphyria, thiopentone. So what matters in the tomorrow's NEETPG exam is, could you revise the 22,000 PYQs? 22,000 PYQs. Once you finish 22,000 PYQs, how do we get 22,000? 10,000 PYQs from NEETPG, class 10 years. 6,000 PYQs from FMGE, last 10 years. 6,000 PYQs from INICET. Pura 12,000 plus 10, 22,000 once you are able to finish it, at least once. It takes 200 hours to be with me for you to follow, right? Every day we will discuss. 100, 150, 200, we keep discussing. So, automatically you know what is asked by examiner, what do I need to prepare, what I need to remember, what is the list of things in the last moment to revise. You don't need any coaching guru or a coaching classes or plan A's, plan B's. Nothing is required. And remember, NEETPG or FMG or INICET or USMLE, any exam you take, it is not about how deep is your knowledge. It is all about how horizontally spread your knowledge. Do you know the common FAQs? Frequently asked questions. Do you know the answers for them? Right? Do you know the high-yield fact database or not? Could you remember and recall and reproduce in the real exam? That's the only thing should be your goal. So 200 hours, your time investment in PYQs. All right. 50 subject-wise mock tests and discussion on every Friday and Saturday. 25 full-scale grand test and discussion on every Sunday. More than enough for you to become the winner. That's my promise to all of you. Good to see 7 online classmates. So now, Dr. Thiopentone, acute intermittent porphyria, where it is contraindicated. Chloroform. Chloroform is not only hepatotoxic, chloroform is also cardiotoxic. Now, whenever you give spinal anesthesia at a little higher level, high spinal anesthesia is characterized by 2 complications. One is hypotension, second is bradycardia. That's the reason we need to be doubly careful, especially in children. We should not really go for a high spinal anesthesia because these are the 2 complications that are common. So how do you initially manage the cardiac arrest shock? We give chest compressions 30:2, right? You need to be very sure on the protocol. Salix maneuver means what? So whenever you are operating on any pregnant women, right? So pregnant women. So in the respiratory tract, the GIT secretions can slip into the respiratory tract because there is a very high intra-abdominal pressure in the pregnant woman. And what is that called? That's such a kind of an aspiration in a pregnant woman. It's called Mendelssohn syndrome. Mendelssohn syndrome. To avoid it, what will you do? You will apply a pressure on the cricoid while you are intubating the patient, so that application of the pressure on the cricoid will prevent the secretions in the gut from entering into the respiratory tract, and that prevents the development of Mendelssohn syndrome is what you have to remember. So this is how, doctor, you apply the pressure, right? You apply the pressure on the cricoid while you are doing the intubation, so that you are preventing the gastric secretions from entering into the respiratory tract, which is called Salix maneuver. Now, fat embolism. Whenever long bone fracture is there, after the long bone fracture, patient goes into altered sensorial. There are a lot of petechiae on the front of his chest, right? And there is a respiratory failure. What is the clinical picture called? Fat embolism. It is the mobility of the fracture which will dislodge the fat and make it to embolize. It is mainly responsible for the fat embolism. That's the reason you need to be careful. Ketamine can cause hallucinations, emergence, delirium. They're all the side effects of the ketamine. Succinylcholine can cause very important dysregulatemia. What is that? Hyperkalemia. Hyperkalemia is the complication of succinylcholine. Mendelssohn syndrome, already we discussed in pregnant women, the aspiration of the contents of the gut into the respiratory tract unless you do the cricoid pressure, which is called as Salix maneuver, is Mendelssohn. Now, compression should be how much depth for the adults? 2 inches is the gold mark that you need to remember. Laryngeal mask airway, it will maintain the airway, but it does not always prevent the aspiration. Laryngeal mask airway, which is a supraglottic airway above the you are not fully intubated above the vocal cords cannot prevent the aspiration, unlike an endotracheal tube. Now, lignocaine, what is the percentage in which it is used? It is 2% jelly and 4% injection. You see, lignocaine. So, what is the pin index of the nitrous oxide duct? It is 3.5, 3 and 5 is the pin index. Vecuronium, among the muscle relaxants, vecuronium can be given when the patient is having the renal disease. Rocuronium is the fastest onset among the skeletal muscle relaxants. Huffman's degradation is seen with atracurium, cisatracurium. Now comes a very important question. Mapleson systems. Mapleson A circuit is very efficient for spontaneous ventilation. Spontaneous ventilation. Now let us quickly have a word on the various Mapleson systems. So how do one type of Mapleson system differ from the other type? So where is the free gland? Free gas flow. So where is your bank? And where is the mask? Where is the, these are the things that decide. Accordingly, you have Mapleson A, Mapleson B, Mapleson C, and Mapleson D. This is Mapleson E, and this is the Mapleson F. All decided by where is the fresh gas flow is located in relation to the mask and the bank. Alright. So only for exam sake, you try to remember what is the position of each of them, of the 6 systems, because examiner often gives it as a image based question. The second, I'll once more another high yield fact, I will take differences between one Mapleson from the other. Now, lidocaine. Lidocaine is the shortest acting spinal anesthetic agent. And high spinal anesthesia, as we discussed, can lead to bradycardia and hypotension, especially in children. Meyer-Overton Rule. It typically applies to the inhalational anesthetic. So what is Meyer-Overton Rule? So Meyer and Overton has created a relation between the oil-gas partition coefficient, how well a given anesthetic is lipid soluble, and the minimum alveolar concentration. What is the relation between the two is called Meyer-Overton's principle. According to the graph, you will have nitrous oxide on this side and halothane on the other side. At least these two extremities, remember, nitrous oxide that side, halothane is on this side. Bas, more than enough. Celiac block. It is typically administered whenever there is any abdominal malignant growth to control the infiltrative pain. So this is how, doctor, here we have the celiac plexus, which is typically blocked whenever there is any malignant growth. Alfentanil. Alfentanil causes the chest wall rigidity through mu receptors. Fentanyl induced muscle rigidity also is because of mu receptors. Sevoflurane is the choice agent in pediatric patients. So many times, whether you go to the INICET question bank or NEETPG question bank, or you go to the FMGE question bank. This is one of the favorite areas for the examiner. Then sevoflurane is also fastest acting. Atracurium is used in case of renal failure. Right now. So thiopentone is contraindicated in porphyria. So many repetitions. Acute intermittent porphyria, is a contraindication for using the thiopentane. Initial management of the cardiac arrest is best done by the principles laid by the American Society of Anesthesiologists. Now comes a little different question. So whenever you are giving a local anesthetic which is blocking the sodium channels, what is the sensation first to be lost? So typically it will affect the A delta fibers. A delta fibers. That's the reason, bachcho. Pain is the first sensation to be lost whenever the local anesthetic is acting. Pipivacaine is the longest acting local anesthetic agent. Huffman's elimination is seen with atracurium. So what is the World Anesthesia Day? 16th October. You remember 2nd October is Gandhi Jayanti, right? November 14th is Nehru ji ka birthday. 2 days later, anesthetize yourself. 16th October, right? Now, Huffman's elimination is seen in atracurium. Right now, cocaine, tetracaine, chloroprocaine, only one I is there. That's the reason they're all what? Esters. So what is the shortest acting? Right? Succinylcholine. What are the specialties of succinylcholine, doctor? Succinylcholine. Shortest acting. Really, it can lead to muscle pains because during the phase 1 block there will be fibrillation of the muscle when you give succinylcholine. That's the reason post-operatively the patient will have tenderness of the muscle if you use the succinylcholine. It is a depolarizing agent, it is the succinylcholine. All curare derivatives are all atracurium, mivacurium, all curare derivatives are non-depolarizing is what you have to remember. Now, what are all the agents that lead to malignant hyperthermia? Malignant hyperthermia. Don't forget desflurane, sevoflurane, right? Desflurane, sevoflurane, isoflurane. They are all the agents which are known to lead to the malignant hyperthermia. Now, ketamine. If you happen to give ketamine, what are the specialities of the ketamine? Ketamine cause analgesia. Ketamine lead to amnesia and increased cerebral blood flow. Raised ICT, raised BP, emergence delirium, dissociative anesthesia. All these words must be there in your tips when you go to the exam when we talk about the ketamine. Now, whenever you are doing the intubation or resuscitation, what are the steps? Head tilt, chin lift, jaw thrust. Head tilt, chin lift, jaw thrust. There are the three things to be remembered. So, doctor, what is this called as? Chin lift, head tilt, jaw thrust. Why is Kolavari Day? Right? Now, Halothane. What are the quick key points you need to remember about halothane? Amber bottles in which it is stored. Halothane is erythmogenic. Halothane can cause hepatitis. They are all the features of the halothane. Endotracheal tube. We use with what all the purposes. One is it provides pulmonary toilet and decreased consciousness patients. We use it, and whenever there is any obstruction in the respiratory tract also we use endotracheal tube. Now, ketamine lead to increased intracranial pressure. Now, anesthesia in a chronic smoker, anesthesia to chronic smoker, what are the complications? It can lead to bronchospasm, atelectasis, and pneumonia. That's the reason you need to make the patient accept that risk before you take up a case of anesthesia in case of a chronic smoker. Nitrous oxide, is it metabolized? No, sir. It is not metabolized by the body. Now, in Mallampatti classification, when do you call class 3? Yesterday we discussed Mallampatti classification is used to assess the airway pre-anesthetically before you are intubating. Tonsillar pillars and uvula are not seen in class 3. Then ketamine can rise the BP, hence it is not used in the case of the hypertensive individual. So what happens if you are in a fed state? Once more, doctor, starvation and feeding state. Can online students can punch? Is the voice loud and clear? In a fed state, insulin level is increased and the glucagon level is decreased. Insulin level is increased and glucagon level is decreased. Then thermogenesis is thermogenin. Where is it located, doctor? It is present in the mitochondria. So you should know, typically you have a ATP synthase and thermogenin in the mitochondria will cause whatever the ATP produced, instead of producing ATP, it will use all that energy in order to convert that into heat. That is a function of thermogenin. Gaucher's disease. What is deficient of? Glucocerebrosidase deficiency is the Gaucher's disease. Any number of times you take NEETPG exam, this is one favorite question which is going to be asked. So you should know this very, very fundamental image should sit in your mind. GM2 ganglioside become GM3. And what is that enzyme involved? Hexosaminidase A. Right, doc? Then GM3 converted into glucocerebroside, and glucocerebroside can originate even from ceramide. So this enzyme is called alpha galactosidase A, and typically your Gaucher, right? So is typically involved when glucocerebroside convert into ceramide. Then here you have something called glucocerebrosidase, and this is where the Gaucher is involved. Then sphingomyelin converts into ceramide, and this is called sphingomyelinase. Sulfatides become galactocerebroside, and this is the place where aryl sulfatase A is the enzyme involved. So in all these conditions, you need to know which enzyme is involved in which stage and which enzyme deficiency lead to which condition. One of the favorite questions. Now, between kwashiorkor marasmus, which baby is fat? Kwashiorkor baby is typically fat, marasmic baby is typically emaciated, and you need to know the differences between the two babies. A vegetarian patient is having a hypersegmented neutrophils. What is he most likely to have? So you should know increased segments in the neutrophil. Can you appreciate that? Increased segments, increased lobes in the neutrophil. So many lobes is an indication of megaloblastic anemia, which can be because of vitamin B12 deficiency. Now, classical galactosemia is caused by which enzyme, doctor? Galt deficiency. Galt is also called galactose 1-phosphate uridyl transferase is the name given for it. Galactose 1-phosphate uridyl transferase is classical galactosemia. Classical galactosemia. The subcellular organelle which is associated with killing the viruses and bacteria, who is that killing machine inside the cell? It is the lysosomes. Lysosomes are the killing machine. Cholesterol is synthesized from where? The origin for all the cholesterol is acetyl-CoA. So you need to know acetyl-CoA. Right now, acetyl-CoA plus acetyl-CoA together. By the action of the HMG-CoA synthesized became HMG-CoA hydroxymethyl butyryl-CoA. HMG-CoA becomes mevalonate by the action of the HMG-CoA reductase. So fundamentally, your statins don't act on synthesis; they act on reductase. Please don't forget. Mevalonate becomes squalene, squalene becomes cholesterol, is what you have to remember. So once more, cholesterol synthesis, what is its regulation? Favorite question, because hypercholesteremia, hypertriglyceridemia, types of hyperlipoproteinemia, they're all the part of our day in and day out clinical practice. That's the reason examiner love to ask the questions on them. The fat is stored in the tissues in what form? Triglycerides. How much should be the triglyceride? Remember, triglyceride less than 150. You tell the grandma you will live up to 150 years. LDL cholesterol less than 70 if there are risk factors and less than 100 without risk factors. LDL cholesterol. Then you tell grandma you will live up to 100 years. If the HDL ideally should be more than 40, it should not be less than 40. So that brings us to the end of today's wonderful evening, doctor. Almost 115 PYQs. You and me work it out today together. Like this, we revise all the 22,000 PYQs and one day tell the world, after 200 hours of journey together, yes, I'm ready for any damn exam in the world. So be part of our WhatsApp study group, and please remember our 999 program. I hope all of you know this, right? So we have a program called rupees 999. What is this? In this, you get 12 months of coaching. 12 months of coaching just for 999 rupees. How? There are about 300 hours of video divided into short videos which discuss almost 52,000 high yield facts. 52,000 high yield facts. Short video, 5-minute video, almost 3,500 5-minute videos are there. In the question bank, we will give you a web access. Plus, we also provide you with 200 hours of revision covering 22,000 PYQs, 22,000 PYQs in the next 6 months. Live. This part is live. This is live broadcast on the YouTube, but later removed from the YouTube, and this video is archived into the video library on the web. But every day you have a teacher with whom you can interact. Also, you will be part of our WhatsApp study group, and I keep posting you a lot of audio mantras, the questions, to inspire your preparation. Always remember, very minimal should be the assisted ventilation from the teacher. Maximum should be your effort, discussion with your classmates, and self-preparation. That is the secret of becoming a topper. By going to a crowded face-to-face classroom, dream team of teachers, This is all commercial propaganda, doctor. What is important? Can you be able to prepare with a nice 1 or 2 friends? That is the only way to become the topper. Good night and enjoy the preparation. Another 6 months, you are a different human being after being with Dr. Murali Bharadwaz. Good night.